Let us study the portal vein. The portal vein is a special vein that starts from GIT and it terminates in liver. It starts in the form of capillaries and it terminates as an artery. So you have a liver. Liver receives 80% supply of blood from portal vein and 20% from hepatic artery. Hepatic artery provides oxygen, portal vein provides nutrients. Now, the formation. Formed at the level of L2 behind neck of pancreas by the union of splenic vein and superior mesenteric vein. This is your portal vein and this is your inferior mesenteric vein. So inferior mesenteric drains into splenic. I hope that's clear. So now let's move ahead and talk about its tributaries. Tributaries are divided into three categories: formative, the ones that drain into portal vein, so drain to portal vein, and the third that drain into left and right branches of portal vein. So after reaching liver, over here the portal vein divides into two, the left branch and the right branch. So now let us talk about these. The formative ones are your splenic vein, superior mesenteric vein. The ones that drain into portal vein are your left gastric, right gastric. These are the ones that drain into your portal vein, and the ones that drain into the left and right, the ones that drain into the left is basically your para umbilical veins, and the ones that drain into your right is basically your cystic vein. Now you need to remember one thing, something about the bloodstream. Okay, the blood coming from the splenic vein is that blood travels from the left hand side, and the blood that is coming from the superior mesenteric vein travels from the right hand side. So there is no mixing of blood. So what can you understand from here? That the blood from superior mesenteric vein is basically received by right lobe, and the blood from splenic vein, inferior mesenteric vein, is received by left lobe. So let us write this down. So left lobe receives the blood from splenic vein and right lobe from superior mesenteric vein. I hope this is clear. Okay, now we need to have a look at its parts. So in order to study the parts, we will draw a similar diagram. This is your liver. Over here have your duodenum. Then over here you have your pancreas. Okay, so let's have a look at the parts of portal vein. This is the first part. This is the next part, and this is the third part. Or actually it's labeled as first, second and third. So the first part is your infraduodenal. The second part is retro, and the third part is supraduodenal. So these are the three parts of duodenum. Now let us study the porto-caval anastomosis. So what is porto-caval anastomosis? These are the sites where the portal system, the veins of portal system are forming the anastomosis with veins of caval system. That is portal vein with caval system, that is going to be IVC or SVC, but mainly it is IVC only. So caval system consists of IVC, SVC, portal system is portal vein. Now let us note down the sites first, and then we'll study them with the help of a diagram. The first site is lower end of esophagus. The second site is anterior abdominal wall. The third site is rectum. The fourth site, rectum, not rectum, but I should rather call it as anal canal, not rectum, but anal canal. The fourth site is bare area of liver. Fifth is ligamentum venosum. Sixth is posterior abdominal wall. The seventh is site of falciform ligament. So these are the certain sites. Out of these three you have to remember in any case. These are most important. Rest of them, like if you can remember, it's good, but if you cannot, it's okay, no problem at all. So now let us study these with the help of a diagram. So over here you have a liver. This is the portal vein that is coming out from here. Superior mesenteric, inferior mesenteric, splenic, this is the colic vein, left colic vein, and inferior mesenteric continues as the superior rectal vein. So the first one, that is about the esophagus. You have an esophagus over here. So at the lower end of the esophagus, you have the certain veins which drain into left umbilical vein. And where does left umbilical, I'm saying left gastric vein. Left gastric drains into portal, and over here it also drains into accessory hemiazygous vein. And if portal hypertension takes place, it leads to esophageal varices at this site. The second site is your anal canal. So in anal canal, you have anastomosis between the inferior mesenteric vein, or rather I should write it as the superior rectal vein, which in turn drains into inferior mesenteric vein and middle rectal vein, which is a tributary of caval system. And then another important one is the anterior abdominal wall. In anterior abdominal wall, you have the anastomosis between superficial veins of abdomen and para-umbilical veins. Superficial veins of abdomen, they drain into caval system, and para-umbilical veins, they drain into portal system. Para-umbilical veins, they drain into I should draw it from the side. They drain into the left branch of portal vein. Now, on the similar diagram, let us study the other sides. And then in the end, you can screenshot a clean diagram also. Okay. So the other sides were basically, this is your colic vein, the left colic vein. In the posterior abdominal wall, you have a kidney. This is your renal vein. Renal vein forms anastomosis with left colic vein as well as with splenic vein. Then over here you have the bare area. Through the bare area, the hepatic sinuses, or the hepatic sinuses, they communicate with mediastinal or phrenic veins. Then during pregnancy, in the case of fetus, ductus venosus is patent, and this acts as a shunt between the left portal vein and the IVC. So now I will draw a clean diagram over here, which you can copy. So you can copy or screenshot this image. If you draw this diagram, for sure you will pass if the question is asked with respect to the portal caval anastomosis. Thank you, and if you have liked this video, don't forget to like, comment, share and subscribe. Bye bye.